Hi, everybody. Welcome to week 5 of the spring semester. Let's see, announcements for this week. I sent the link out earlier for the Sigma Phi Alpha voting. So if you feel that you are familiar enough with the students who were nominated to be able to cast a vote, please use that link I sent you to get your vote in. A couple reminders: students should not have phones out at any point in clinic, including if they're doing a radiographic evaluation. So if they tell you that their phone's out so that they can complete that, let them know they should complete the radiographic evaluation on their iPad instead. So no phones out during clinic. The only exception would be if they asked you in advance if they could have their phone out for some reason. Sometimes if they have kids and they're anticipating an emergency call or something, we might make an exception. All personal items for students should be stored in their lockers. So even if the student doesn't have a patient, they can't bring their book bags and beverages and things like that into the clinic area. That all needs to remain in their locker. A reminder to look at all the sections on the patient trackers to make sure that students are completing everything and that you are completing everything, especially the final grade section. So when you're doing your calculus or deposit removal check for calculus, and polishing and scaling, just make sure that you have filled all those boxes out and you have given the students a final grade. Another reminder is on face shields. Anytime the student is working on the patient, so they're working in their mouth, that face shield needs to be down. If they're sitting up and they're completing paperwork or something like that, it's okay for the shield to be up. But as soon as they start working on the patient again, they need to put the shield down. So if you notice that is a daily performance error. So please make sure that you issue that error and remind the student that the shield needs to come down. Okay, information for first year students. They begin seeing real patients this week. So most of the clinics this week, they will be seeing patients. Tuesday, however, for the morning session and the afternoon session, that is impressions lab. So we do not have patients scheduled for Tuesday morning and Tuesday afternoon. Faculty, RDH faculty should still be here to assist with the impressions, but otherwise no regularly scheduled clinic that day. You will see if you are in Monday evening or Wednesday evening clinics that we have a second year peer teacher available. That is the same process as in the past. The peer teachers will be assisting the students, answering questions. They can help with radiographs. They can even help with radiograph placement. That is totally fine if they're helping to position or helping the first year position their RIN kit. That's allowable. They can also do polish and OHR self-care instruction checks. And again, just sort of answer questions, give advice, be helpful. So they will be here Monday night and Wednesday night. First year students, when they take a PAN for the first time, they need to complete a PAN tutorial. That is not a skill eval, that is a tutorial, although you will fill out a skill evaluation form for them so that Jen knows that they completed that. I put a paper copy of the skill evaluation tutorial form in the faculty office on the whiteboard so you can read through it. When I do those, I basically just read through the instructions on the wall and help the students to complete each step one at a time. So that is how the PAN tutorials will work for first year students. Second year clinic info, please remember to check ultrasonic tips after students are done using the ultrasonic. We did have someone catch a bent tip this past week, and when they asked the student about it, the student said, "I dropped it." So for us, that's really helpful information to try to figure out why these tips are breaking. So please be sure to check the tip and then also ask the student if it's bent, what happened. Another thing for second year students, if they forget to document their 4 areas of speed bump calculus. You can take that off on daily performance, just use the other section. It's a semi-critical error. And we're going to use that until the new version of the daily performance form is available. So that may not even happen until next fall, but you do have a place in the meantime that you can document that. Otherwise, I hope you have a wonderful week. If you need anything, have questions, you know where to find all of us. See you around.